All right, so today this is our Executive Function Expert Series. And today, Dr. Bylund will be presenting on executive function in schools, identifying, assessing, and advocating. A little bit about Dr. James Bylund. He is a clinical and educational psychologist. He specializes in evaluations of neurodevelopmental disabilities, and he's the founder and owner of the Bylund Clinic. And today's webinar is brought to you by EF Specialists. If you want to learn more about that, you can visit the link at efspecialist.com. We'll be sending that out after as well. And then just real quickly, before we jump into Dr. Bylund's presentation, you're probably going to have a lot of questions and be curious about the topic here. And I want to share with you, if you want to learn more about these topics like assessments, special education, things of that nature, if you go to efspecialist.com and you go to our articles section, we recently built out this whole section on special education. So you can always go up here and search for it. But if you scroll down to special education and click on this header here, we have a whole section dedicated to special education topics. So for example, if you scroll down, these are our top articles, such as navigating the special education system, how to get an IEP, requesting additional assessment. And then you can scroll down here and you can also look at some of our top resources on special education that we've shared from other thought leaders in the field, as well as all of our articles on special education. So there's a lot of really good stuff there that can support your journey towards understanding your rights as a parent, how you can support as an educator or coach, and feel free to ask any questions about that. Now, through the webinar, what I'd like you to do is there's a Q&A section or box on your panel. So if you have a question, put it in the Q&A box, and then throughout the webinar, I'm going to ask Dr. Bylund your questions so you can get your questions answered. Please don't just unmute and start talking, just so we can keep it orderly and make sure everybody gets their questions answered throughout the webinar. So as I said, please use that Q&A box. So without further ado, I'm going to pass it to Dr. Bylund. Thank you so much for joining us today and creating this webinar for us. And I'm going to put the spotlight on you.
Yeah. Yeah, thanks, Sean. Really appreciate the opportunity to come join you today. So I appreciate that, Sean, and really appreciate everybody else who's here taking the time out of, I'm sure, very busy lives to listen in. So let me pull up my slides here. Hey, Sean, you see that?
Yep, I can see it. Yep.
Okay.
We're good to go.
Okay, perfect. So obviously, we're talking about executive functioning today. But also really wanting to talk about executive function in terms of assessment. What does assessments look like? Also special education eligibility related to executive functioning challenges, and also talk about independent educational evaluations as well too. So we're going to cover a lot of ground really fairly quickly. So again, as we go through, if you have questions about anything that I've shared or comments you'd like to share with the group, please just go ahead and put it in the chat. And Sean's going to sort of stop at natural breaking points in the presentation to offer those thoughts or ask those questions, and I'll do my best to try to answer them. So I figured a good place to start is just what is executive functioning. I imagine most people here probably have a sense of what executive functioning is. 15 years ago, this was sort of a new topic when it came to school-based evaluations and special education eligibility. And there was a lot of questions about what is executive functioning and how is it assessed. And frankly, over the past few decades, there's a lot of people have proposed a lot of definitions in terms of what exactly executive functioning is. And some models have, 5 components of executive functioning. Some models have 40 or 50 components of executive functioning. But there's certainly things that all of those models have in common. And a lot of times people will talk about maybe the chief executive officer, right? Sort of overseeing the activities of all of the other people that work for the company as sort of this, way of conceptualizing executive functioning, or maybe the I'm drawing a blank on the word, but like the director of an orchestra or something, right? They're not the ones playing the instruments, but they're the ones telling telling all the instruments what they need to do. For me, when I think about executive functioning, I really like to think about this idea of executing. Right, it's I may have the individual skills to complete a particular task, but I struggle in executing that task. And an example may be like my 9-year-old son, right? Like when he needs to go clean up his room, he certainly has the physical ability to pick toys up off the ground. He has the physical ability to take his dirty laundry and put it in the hamper, and he has the physical ability to fold his clothes and put it away in the closet. Yet, when I go and tell him to go clean his room, a couple minutes into it, he's, on his bed playing with the toys, right? So he has the skills to do it, but he's struggling to execute it. And maybe, he's having a hard time getting started on the task, or in his case with cleaning his room, he has a hard time with just sort of goal-directed persistence, like sticking with it until it's completed, right? It's a challenging task for him, as I imagine it is for, a lot of 9-year-olds. And we'll talk about executive functioning today, both in terms of like a neuropsych assessment, what we're looking at, what executive functioning is, and also just sort of like practically, like what does executive functioning look like? And I know Sean has a really great acronym for it. I think it's positive, right? So, the P being for, and Sean can correct me if I'm wrong here because I could totally botch this up here, right? But, planning, being able to organize, being able to self-monitor or self-regulate, being able to initiate tasks, being able to time management, being able to manage time, being able to sort of inhibit automatic behavior, sort of this behavioral inhibition, be able to create a vision or be able to set goals or plan for the future, and the ability to sort of evaluate what we've done and see whether or not we're on track and meeting our goals, right? So I really like Sean's model because it provides a really sort of practical uh, way of looking at what these executive functioning skills are. And sometimes when we do neuropsych assessments, we're a little abstract, right? And so I really like how Sean's laid that out. But some of the things I think all models of executive functioning have in common are things like attention, right? Can I focus my attention on a task, and can I sustain my attention to that task long enough to be able to see it completed? Working memory is a really, really big one. Certainly from my perspective, looking at through neuropsych assessments, this ability to mentally manage all of the information I need in order to be able to execute that task, right? So, for the example for my son, right, like he needs to remember, okay, I need to pick up all the toys. I need to take the dirty laundry out of the room. I need to fold my clean laundry, and I need to make my bed. And he needs to keep all of that active in his mind long enough in order to be able to execute that task. And that then really sets the foundation for a lot of other things like planning tasks and activities, remembering, what are all the steps needed to complete it, and be able to organize the tasks and activities in order to be able to get them done efficiently. But also things like task initiation, just even getting started, which is, very obviously a very important executive skill, right? To be able to get started on the task, and then to be able to see it through to completion. But other things, other executive functions include things like being able to think flexibly. So maybe I've decided to try to achieve a goal, in a particular way, and I'm struggling to achieve that goal, and I need to be able to think flexibly. What are some other ways I might be able to go about doing this in order to reach the outcome that I desire? And one that we're not going to talk about quite as much probably today, but I think a really important one, and it's certainly a really important part of executive functioning is just emotional and behavioral regulation. Can I deal with the small challenges that I experience without becoming overwhelmed by them? Is a really important area of executive functioning as well. So what does this look like in schools? I think probably for most people who are interested in this topic probably have a pretty good idea of how this shows up in schools. But I'm having a hard time keeping track of all of my assignments and their due dates. I'm having a hard time remembering what I need to do and when I need to do it by. I'm having a hard time remembering what the steps are, the instructions that I was given in order to be able to complete those tasks, because I'm struggling perhaps with working memory. Maybe I'm having, related to that, right? If I'm having a hard time remembering my assignments and their due dates, probably have a really hard time managing my homework independently. Having a hard time remembering deadlines and making sure that things are completed and turned in on time. again, sort of related, right, is my ability to organize tasks and activities. So even when I remember what that assignment is or what it is I need to do, I can't find the materials I need in order to be able to get it done. So my workspace at home is a disaster. I can't find anything in my backpack. My desk at school or my locker at school is a mess. And so I know what I need to do, but I can't find the materials that I need. Getting started independently is a big one, because if I have a hard time initiating and getting started on tasks, then I'm not going to be able to complete those, right? If I'm not even getting started on it. And so, task initiation is a really big one. Challenges with transitioning between different tasks and activities. We talked about, flexibility, being able to come up with different ways to be able to solve a problem, but also the ability to stop one task in order to be able to initiate another one. And we see a lot of kids in schools for various reasons, whether it's, executive functioning or executive functioning challenges related to anxiety or whatnot, having a hard time being able to stop one task to be able to start the next one. And one that we see, more oftentimes with kids with executive functioning difficulties, parents are dealing with a lot of this at home, even more than they may be dealing with it at school. But a lot of the frustration and emotional outbursts that are triggered by these challenges as well too. Now, executive functioning is, executive functioning challenges are seen in a lot of different neurodevelopmental disabilities. So, we'll cover, three big ones here, but certainly not limited to this by any means. A lot of different neurodevelopmental disabilities have accompanying executive function challenges. A lot of psychological disorders have, accompanying executive functioning challenges. But one of the big ones we see frequently and oftentimes associated with executive functioning is ADHD. And in fact, I think a lot of sort of researchers in the field of ADHD, would agree, that at the core of this disorder is impaired executive functioning. And when you look at the clinical diagnostic criteria for ADHD, it's really sort of a list of different executive dysfunctions that somebody might experience. And with ADHD, of course, there's, well, I guess sort of three subtypes, right? We have kids who struggle with inattention. We have kids who struggle with, hyperactivity and impulsivity. And we've got kids that struggle with both, right? But some of the core features of ADHD being difficulties with impulsivity, so that inhibitory control aspect of executive function, difficulties with focusing and sustaining attention to tasks is really core to the disorder. But when you look at the diagnostic criteria, I mean, it also looks at things like difficulty organizing, difficulties with memory, and certainly in the sort of category of hyperactivity and impulsivity, difficulties related to self-control. And so, impaired executive functioning really being at the heart of ADHD. Another neurodevelopmental disorder that we see oftentimes with a lot of executive functioning challenges is autism. And sort of just to sort of acknowledge too, a significant number of individuals with autism also meet clinical diagnostic criteria for ADHD. I mean, I could be wrong here, but I think it's as much as like 70%. So a lot of times, we might get a referral, asking, hey, is this autism? Is it ADHD? And I think we really do a pretty good job in our referrals in terms of like teasing out what are sort of the sort of overlapping and distinguishing features between those disorders to know if it's really one or the other. But a lot of times, right? I mean, at least according to research, 70% of the time, we're going to see kids maybe meet diagnostic criteria under both. But some of the sort of kind of distinguishing features of executive functioning challenges in autism really have a lot to do with the restricted repetitive behaviors and/or interests that are part of the diagnosis. So the difficulty tolerating changes in routine, right? Because a lot of the cognitive rigidity and difficulties with flexibility, a lot of the perseverative thinking, again, associated with executive functioning and poor cognitive flexibility. I mean, even if you were to think about things like some of the repetitive behaviors, difficulties with flexibility and transitioning out of those activities, or even a lot of the sensory sensitivities, just being able to tolerate and adapt to different sensory input in our environment. And so, when we're looking at autism, certainly core to the disorder is impairments in social communication and interaction. I mean that's really at the heart of it. But a lot of these restricted repetitive behaviors and or interests are really tied to impaired executive function. And then also I want to put up here learning disabilities also. I'm going to call out sort of working memory in particular here, but certainly learning disabilities may be related to other aspects of executive functioning. But working memory, again, that ability to mentally manage the information I need in order to be able to execute a task. We really see that, especially as kids are getting older, really impacting academics, particularly around things like reading comprehension or written expression. Or math computation, right? So, in the younger grades, they're just kind of like learning how to read, right? So those are a different set of skills that we need to develop in order to be able to decode words and then to be able to read fluently. But then once we get to that third or fourth grade, right, we're really expected to read for comprehension. And again, the ability to mentally manage information that's sort of coming in long enough in order to be able to complete a task. And I mean, it could be completing a task like cleaning my room, but it could also be completing a task like comprehending a, a passage or a chapter that I just read, right? So even if I'm reading accurately and fluently, I have to mentally manage all of that information that's coming in so that I can comprehend it. Math is a big one, particularly once we get up in the grades and start getting into multi-step problems. So we can have a kid that, understands math conceptually really well, right? And they might even have just sort of automatic math fact retrieval, right? But once we get into things that then require multiple steps, they may really struggle because of working memory and other executive functioning challenges. So, when we're testing them, anything that requires one or two steps, they might do great. Like, they might know how to do basic algebra and they know how to add and subtract fractions. But as soon as you get to problems like, multi-digit multiplication or long division, or, for some of these kids, multi-step addition and subtraction with regrouping, we see them start to have a lot of difficulty, sometimes even just skipping those problems altogether when we're testing them, because they really struggle with anything that's multi-step. So they're having to keep track of all the steps in order to complete the problem, execute them in the correct order. They may really struggle with that. But the area where I say we see it, well, I mean, it's hard to say general statements, but certainly an area that requires a tremendous amount of executive functioning is just written expression. And so kids might have, again, sort of the component skills, right? They know how to spell, may or may not have good, fine motor skills, but they know how to spell. They know where capitals should go. They know where the punctuation should go. They know how to, compose a grammatically correct sentence, right? But then they really struggle to put all those pieces together, right? Because now I'm having to work, make sure that I'm forming the letters correctly, I'm spelling them correctly, I'm having to focus on capitalization and punctuation, on grammar and syntax, sentence structure. I'm also having to think about how to communicate these ideas coherently, so that the reader, who I presumably don't even know who they are, is able to sort of follow my train of thought. This requires a tremendous amount of executive functioning skills. And one of the things that we see in our assessments too is maybe the school did an evaluation of writing that really only required them to write, a sentence or maybe two sentences in order to be able to complete a paragraph or describe a picture, and they do beautifully on it. But then when we dig a little bit deeper and assess their ability to compose a longer written product with a fairly open-ended prompt, then suddenly we see the challenges that they're experiencing with writing because of those executive function challenges. So again, we see, across, probably all neurodevelopmental disabilities, some executive functioning challenges. We certainly see executive function challenges with, other, social and emotional conditions. But these are three that, oftentimes come up for us when we're assessing kids. So sort of transition here a little bit. I don't know, Sean, if there's any questions as far as executive functioning, but sort of going to shift gears a little bit into school-based evaluations.
Yeah, well, there is one that came up, two questions that came up. So the first one was key accommodations or modifications that we should be looking for when drafting a transitional IEP for a student graduating high school, from Karen. And so curious here, I know because the IEP and 504 doesn't follow a student into college, there are students in special programs post high school. But what are your thoughts on how you kind of help prepare a family who might have a student who's a bit older, who's transitioning to college or something beyond high school in terms of creating the assessment so that it can support their ongoing needs?
No, it's a really great question. And Karen, it's a really big question. So I'll do my best to answer it from my lens, right? So and my focus is really on um, assessing and diagnosing neurodevelopmental disabilities. Do a lot of independent educational evaluations, which we'll talk about. And I think this question of transition is coming up more and more, right? And something that actually our clinical co-director Danielle has put together an entire um, manual, for us, and is really sort of our expert in transition assessment. But I would say in my experience, both working in schools and working sort of alongside schools, I don't think I think we could do a lot more in terms of transition planning. I think sort of the brief questionnaires that say, do you want to work on your own? Check. Or do you live on your own? Check. Do you want to go to college? Do you want to work? What do you want to do? Check. I mean, I think these are really sort of not going far enough in terms of looking how we can support kids. And from an assessment perspective, certainly I think sort of clinical interviews with children and their parents around their plans for the future and their level of independence around self-care and finances and planning and organization and so forth, I think is really important. But I do think that we can really go a little bit further in our assessment. I think two areas in particular I think are really important. I think we really should be assessing executive functioning skills. As kids are, well, teenagers, young adults are preparing to leave home, because these executive functioning skills are so important for independence. Really central to our ability to function independently. And the other area I'd say we really need to take a look at are adaptive skills. And so, a lot of times, assessing adaptive skills are sort of overlooked when we have a kid with general average range cognitive abilities. But when we have impaired executive functioning skills, sometimes we really see pretty significantly impaired adaptive skills. So their ability to manage finances, their ability to, in some case, even just sort of like self-care and hygiene and make sure that they're caring for themselves in that way. Their ability to manage tasks and activities around the home is significantly impaired. And these are all things we're going to have to be able to do, when we enter adulthood and living independent of our parents. And so I do think transition assessments can do a lot more in terms of looking at executive skills and looking at adaptive skills than what is typically done, at this point in schools. And I think would provide a lot more rich information for really looking at ways that we can, support kids to enter adulthood and live independently.
Thanks, Dr. Bylund. Yeah, actually, that's something I just want to touch on as well, that those adaptive skills you're requiring. I think there's a ADL is adaptive daily living skills. Or there's an acronym used for it. There's a lot of research that shows that students, especially students, autistic students who have better ADLs or adaptive daily living skills, have longer lifespans. Like they really contribute to a lack of those skills is very can be negatively impactful. So I appreciate you bringing that up. I'll drop a little article with some research about that into the chat box so people can check that out. Yeah, go
It
ahead.
can be, sorry to interrupt, but it can also be completely independent of like intellectual abilities. Like the pleasure of meeting a young man last week who's a genius, like intellectually. I mean, superior intellectual abilities, but also severely impaired executive functioning and adaptive skills, right? And so, when we're talking about whether these executive functioning skills or these adaptive skills, can be completely disconnected from what some of sort of like verbal abilities are, problem-solving skills or memory skills are.
Yeah, and do you categorize those types of clients as twice exceptional, or do you use another? I know that wording is used in some communities. I'm curious how you if there's a specific kind of way that you categorize or think about those types of clients with really exceptional skills in certain domains, but really struggle potentially in daily living skills or other areas.
Yeah, I mean that's how we conceptualize it. Kids as being twice exceptional, and we've really over the past couple of years been really mindful in terms of thinking about recommendations then that both account for their neurodevelopmental disability as well as their giftedness, and I think it's something that understandably, this isn't like a criticism, right? But understandably, schools may find it really challenging to be able to support those kids, effectively.
So we have a question from Kashif Ali, who is actually one of our Executive Function Coaching Academy graduates. And he said, Dr. Bylund, would you be able to share a list of test batteries that you most commonly use for assessments across these three neurodevelopmental disabilities? As a coach, I'd love to familiarize myself. I imagine that's probably a pretty long list, but
Yeah.
maybe you could touch on some of your, more frequent ones.
Yeah, I do actually have a slide, on executive function, specifically executive function assessments, that we use, both direct assessments. So when a client comes into the office, where a test that we actually administer to them and why, as well as more like rating scale types of assessments, which give us a sort of a sense of how these executive functioning deficits, if they exist, are maybe impacting somebody's day-to-day functioning. So we do have a slide on that.
Okay, great. And then we have someone else who asked, any advice on how to tell the difference between EF issues versus normal/typical lack of motivation, procrastination, especially high school age kids?
Yeah. Yeah. So I pause for a second. These questions are like awesome, right? And I feel like these questions are like an entire presentation, like an hour and a half on their own. But no, really great question and an important one, right? So I mean, I gave the example earlier of my 9-year-old. He probably doesn't have the best attention and executive functioning skills, but he's not he functions adequately. I'm not like overly concerned about it. I think it's probably within sort of typical developmental continuum. But there are a few ways that we take a look at it, right? So and I'll try to remember to come back to this when we do the assessment. One of the helpful things with assessment is it allows us to compare somebody's both their skill, like what we assess in the office, relative to others their age, right? So we have a test that we can take a look at their ability to focus and sustain their attention and see how their performance on that measure, compares to a national sample of other individuals their age, right? So at that point, that's just one way of taking a look at, is this sort of like a lack of motivation or performance due to some other factor, or is there some actual underlying impairment? So one way to do that is to assess it. Another way is even through like our rating scales, the parent-teacher observation and self-report, whether or not people are observing challenges that exceed what is typical for somebody their age, right? So that's another way that we take a look at it. And another way I think it's really important to look at our evaluations is really sort of looking at a person's development over time, right? So, I mean, it used to be that like, you'd have to have evidence of ADHD. It's our old code, so I could be wrong on this, but it was something like 7 or 8 years old. You had to see some evidence of it. Our more recent, not most recent, but more recent diagnostic manuals say, okay, before age 12, for example, because there might be some aspects of inattention and executive function challenge that you wouldn't necessarily expect to see in a 7-year-old that might really start to emerge at 11 and 12 years old, right? So part of it is looking over history. So, if I have a 17-year-old who has senioritis and all of a sudden they look like they have ADHD, well, is there evidence of that, over time, right? So that's one of the things that we're taking a look at as well too. But it can be a really tricky thing to try to tease apart, and it may be both, right? Like I'm thinking of another client like we recently had in our office. Awesome individual, severe ADHD, also like severe senioritis, and severe, like I'm kind of over all of this stuff right now, and I just can't wait to get out of my house and be done with it. So I mean, you could have both at play too, but it's really a matter of, again, looking at our assessment data, how someone's functioning relative to others their age, both in direct testing and what people are observing. Looking at their development over time to see if there's evidence of a sort of delay in the onset of these executive skills that we'd anticipate as kids get older. And of course, they don't all come online at one time, right? Like planning an organization, is going to come along later down the road than, inhibitory control, where I can keep my hands and feet to myself, right? So, there's a developmental stage in these things as well too. So again, I hope that answers the question, but through our assessments, we can tease part of that out. Looking at their developmental history, we can tease some of that out as well.
Yeah. Oh, sorry. And I just wanted to say, from a special educator standpoint, I know we probably have a lot of special educators, learning specialists here today, that before the assessment process, when you're trying to differentiate between normal executive function challenges, and does this child have a disability that requires further intervention? Like Dr. Bylund said, we look at does this issue persist over an extended period of time, oftentimes being multiple years, and is it hindering their activities of daily living or ability to engage in school? And if it's meeting both of those criteria, I think that's a really good sign that this does require further assessment, like coming to someone like Dr. Byland or requesting it from the school.
So to transition here a little bit, for the legal standard for evaluation through schools, and I'll be, I think I'm a pretty honest guy, right? And so I'm just speaking honestly here. This isn't, again, this isn't, criticism of anybody or any agency or school system or anything, right? But the fact is when I entered this field, 15 to 20 years ago, it was a time at which you had more sort of school generated or teacher generated referrals for special education evaluation. This was a time, before all of this information around regulations was widely available online. It was hidden in this sort of code of regulations that you had to order from the California Department of Ed, and it was thousands of pages long, and it was very hard to figure out what parents' rights even were, right? And parents understandably trusting of the school district and the teachers to be able to make those referrals. And so you maybe had 30 kids in the classroom, and there may be, 3 or so kids on the teacher's radar that they might feel, hey, let's take a look at this a little bit closer. You don't get that as much anymore. More and more, what I find are the referrals are generated by the parents, and the teachers feel a little hamstringed in terms of being able to make those referrals, and maybe they might communicate it to parents sort of on the side, right? Like, hey, you might want to make this referral, and I always appreciate it when teachers are forthcoming and honest in doing that. The legal standard for evaluation, it's called the child find. And the legal standard for evaluation is really pretty low, right? So now the threshold for eligibility is high, right? But the threshold for evaluation is honestly pretty low, because all it says, and somebody can correct me if I'm wrong here, but is that there's reason to suspect the child may have a disability that impacts education performance, right? So it's a reason to suspect. Right now, to me, that sounds like a pretty low standard, especially when you look at compared to like eligibility, which is that is required. It's required in order to be able to access and benefit from their education, right? And so I think, unfortunately, I think schools have sort of kind of defaulted to this trying to sort of leapfrog ahead and think like, do we think this kid's actually going to qualify? And if they feel like, well, they're not going to qualify anyway, maybe they might try to like deny requests or try to talk a parent out of it. But again, the threshold for evaluation is just to suspect. So, what is a reason to suspect, right? Well, certainly, teacher observations and reports that the child's having difficulty with their academics or difficulty behaviorally or regulating their emotions. If the teacher generates that, that's obviously reasons to suspect. And I think when they do, the school typically moves forward with that evaluation without question. But to be honest with you, I mean, parent observations are also a reason to suspect. If the parents observing challenges with academics or behavioral or emotional regulation, that may in and of itself be reason to suspect. If a child has a previous diagnosis of some neurodevelopmental disability, like the ones we talked about, or autism or ADHD or a learning disorder, that's certainly reason to suspect as well too. And then kind of related to that first one, right? If the child has poor grades or having behavioral difficulties in school, and even there've been additional supports and attempts to try to help them in those areas, and they continue to have difficulty, again, might be reason to suspect. I think one of the challenges, especially around executive functioning, for us as parents, is we don't want our children to experience too much hardship, right, and too much struggle in school. And we may be doing a lot to help our kids so that they're not experiencing those struggles. So we're doing a lot of help with them individually at home. Maybe we're hiring coaches or tutors to be able to help them stay on top of their work. And sometimes when that kid goes to school, the full scope of their challenges isn't easily observable, and that's no fault of the teacher. The kid's coming to school, their work's turned in, and it looks pretty good, right? But it might always be clear all the work that's going on behind the scenes too. So if as a parent, we're suspecting that our child may have a disability or may require special education services, I think keeping pretty close record in terms of the amount of supports and services that are being provided outside of the school day, so that the school team understands that information, can be really helpful. I know parents who've made a difficult decision sometimes to kind of like sit back and allow their child to function independently, in order to be able to make it more evident, to the school team how much difficulty they're having. I'm not offering any guidance or advice in terms of how to go about doing that, but at the very least, sort of keeping track of what's being done to support them if the school is saying we're not seeing those difficulties, so you can share that information with them.
Yeah, super valuable. Thank you for bringing that point up, and it's good to realize that just a reason to suspect is the criteria for referring a child to be assessed. And we'll go into more detail later about like what are the steps you could take as a parent or teacher, or concerned individual to help out with that. But yeah, let's let you keep going here, and we'll go into more questions later.
Yeah, really. I've had some parents basically do like an ABA test too, where they're like, okay, we're providing this intervention, we're going to pull back for a little bit, see how they do independently, and then for a month or so, and then start again, right? And then they've been able to see pretty clearly how they function with the support, what it looked like without that level of support, then reintroduce that support and see an improvement too. And I think when doing things like that again can be helpful in just sort of providing the reason to suspect. So the question earlier around testing instruments, right? So here's how sort of we conceptualize it at our office, right? And didn't make this up, right? This sort of came out of research done over the years. But the way we conceptualize it in our assessments is there's certain neuropsychological skills, right? That we're able to pretty accurately with validity and reliability to be able to measure that are related to executive functioning, right? So like we can measure how well somebody can focus and sustain their attention to a task, right? We can measure that. We can measure how well they can inhibit an automatic reaction to something, a stimulus, in favor of something that requires more effort, right? The ability to sort of sit back and not react to it, right? We can measure things like cognitive flexibility. We can measure how fluent somebody is in switching back and forth between tasks, right? Essentially multitasking, right? Be able to go back and forth and remember where they left off when they go back to the task that they were previously working on. Or we can measure their flexibility in terms of, how many different ways can I come up with to be able to solve this problem? Those are all things that we can measure pretty well in the office. I put processing speed down here too. Not really an executive function, but really also does help kind of facilitate, other thinking and learning skills. So these are things that we can measure in the office. And then we say, okay, are we seeing impairment in one or more of these areas? Because we might not see impairment in all areas, right? But maybe we see difficulties with working memory and inhibitory control, for example. Then we say, okay, well, how are those neuropsychological challenges then showing up in somebody's day-to-day functioning, right? And we're gathering that information through reviewing records. We're gathering that information through, parent teacher interviews, self-report. But we also have other sort of standardized assessment tools that take a look at that, right? And so these are rating scales that parents and teachers complete that ask questions related to how do executive functioning skills show up day to day. Asking them questions related to their ability to focus and sustain attention to a task. Asking questions related to their memory or ability to remember instructions or steps in order to be able to complete tasks. Ask questions about their behavioral inhibition, their emotional regulation. Ask about planning and organization and goal-directed persistence and self-monitoring, right? And what these rating scales then allow us to do is say, okay, is what the reports that we're getting from parents and teachers, are those sort of outside of the typical developmental continuum, right? Like are they experiencing greater challenges than what is typical for somebody their age? So our assessments, again, really look at this through the direct assessment of what I would consider like core neuropsychological skills that then underlie all of these other executive functioning abilities that we observe day to day. And then we're looking through these rating scales and again, other sources of information to see like how are those impairments manifesting, right? So on top there, we have certain like direct assessments, right? There's continuous performance tests as a direct measure of attention. The DCAFs has multiple different measures of various executive functioning skills. The NEPC does as well, and there's other tools there. But we're looking there to see if there's an underlying skill deficit, right? And then the rating scales, the brief, which is commonly used by schools. We use the comprehensive executive function inventory, but the brief's a great tool too. Some of what they call Conners rating scales, they're really measures of like ADHD, but they include because executive function is really core to ADHD. There are a lot of questions and scales on there related to executive functioning as well too. So, there's others. It's not an exhaustive list, right? But those are the ones that that we commonly use in our office. And again, a lot of times if we see a deficit in neuropsychological processing, we see impairment in day-to-day functioning. Sometimes we see impaired executive functioning in the office, and the rating scales look okay, and that may be because there's a lot of supports in place. The child's in a specialized program that really provides a lot of accommodations and environmental supports around executive functioning, and they're doing well in that environment, right? So we have this underlying skill deficit, but the supports in place are working. Sometimes we see this pattern where all of the skills are intact and their functioning is impaired, and maybe that goes back to the earlier question about they have these skills, they're just not applying them. But it also may be that hey, in a really tightly controlled testing environment, when we're trying to isolate the individual skills, they can do that. But then in day-to-day functioning, where it's not a tightly controlled environment, where there's a lot of distractions going on and things competing for their attention and demands and stressors and so forth, that their executive functioning skills really break down. So I think it was Peg Dawson who, I'm sure people who've been through the training program probably know who Peg Dawson is. I see Sean nodding along. One time I remember she described it as like, it's odd that we come in and test these skills because when we're testing them, because we're trying to isolate individual skills, we're greatly reducing the executive functioning demands placed on the individual in order to be able to isolate this particular skill, right? So they come into, like, I measure working memory, they sit down in front of me, I've got eye contact, I'm like, okay, are you ready? I'm about to say something and I want you to remember it, right? Well, that's a whole lot different than when someone's sitting in a classroom and having to manage information and working memory. So we try to isolate what that individual skill is. And but again, sometimes people come in, we have a lot of really sort of highly intelligent, strong performance on standardized test types of kids that come in that truly across the board everybody agrees is really struggling with executive functioning and have for a long time, even though they do all the tests. So they don't always line up, but I would say the vast majority of times, we see the underlying deficit, we see how it manifests in their life, and then we make recommendations based on how it's manifesting in their life.
Thank you, Dr. Bylund. We have a question coming up here from Kenyatta, one of our talented coaches at Executive Function Specialists. And Kenyatta asked, what type of testing should be asked for a student who may have dysgraphia? And does this count as a second marker for being able to qualify for an IEP in addition to their ADHD?
Dysgraphia. So maybe I can ask a question here too. Are we when we're talking about dysgraphia, because the term is used differently by different people. I think broadly speaking, we think about dysgraphia as impairment in writing. Some people really think when they hear dysgraphia, they think of only sort of the graphomotor difficulties, right? Like the motor aspect of writing. And other people, when they hear dysgraphia, they think more broadly, like so graphomotor skills, spelling, writing mechanics, coherence of written expression. So when we say dysgraphia, are we talking about like the motor, or are we talking about all of writing?
Kenyatta shared both are true for this student.
Yeah, so that would be potentially a secondary area of eligibility, right? So, when you're, well, actually, oh my gosh, that actually fits in perfect. I didn't realize it, right? This actually fits in really nicely with the next slide. I didn't see what was up next. Okay, so when we have executive functioning impairments, right? And again, executive functioning is tied to a lot of different neurodevelopmental disabilities that could be found eligible if it greatly impacts them educationally, under multiple different categories, right? So we don't have an area of eligibility in special education that says they're eligible due to executive functioning deficits. Like we have 13 eligibility categories. None of them are, say, specifically executive functioning deficits, right? So then we're saying like, okay, how is this tied to some potential neurodevelopmental disability and how is it impacting them educationally? Now, I will say that a lot of kids that I see that have executive functioning deficits, whether it's tied to ADHD or tied to autism, really struggle with writing. I see a higher number of these kids having significant graphomotor difficulties, and they really struggle. I can't say like universally. I mean, there's always exceptions, but a significant number of them struggle greatly with the executive function aspects of writing. You put a blank sheet of paper in front of them, and they have a hard time producing much of anything. And what they produce is oftentimes of very low quality, right? So say, for example, to the question here, somebody has ADHD, right? And they have executive function deficits. And their ADHD results in that we're looking at the first one here, other health impairment, right? Impacting their strength, vitality, and or alertness, right? That's the definition of an other health impairment. It can be any number of different health conditions, but it has to impact it has to be chronic, and it has to impact their strength, vitality, or alertness. ADHD wasn't always listed in the California regulations. It was updated, I don't know, it was 2017 or something, where they added it explicitly, right? But it impacts your alertness because that's your attention, and it can impact your vitality, right? It's really your stamina over the course of the school day, right? So if that was the case, yes, you would qualify under other health impairment because your ADHD was impacting your strength, vitality, and or alertness with regards to your education and educational environment. But if you also have dysgraphia, right? And it sounds like in this case, impacting their written expression, handwriting, spelling, mechanics, so forth, right? Then you would also have a secondary eligibility then under specific learning disability. So you could qualify for both. Now, maybe at the core of that is executive functioning, right? But if the executive functioning is manifesting as ADHD, you could qualify under other health impairment. And if it's also manifesting as a learning disorder, impairment in written expression, you'd have a secondary eligibility as well. That hopefully answers the question. And well, I don't know. Maybe.
Yeah, she said thank you, so I think it met the need.
Okay.
Before we switch to the next category, and it's really important to note because I know, for people that, yeah, ADHD is not what you're going to share here is not an eligibility category, right? So technically, you can't get an IEP just for ADHD. It has to fall into these categories that you're going to share about, whether it's specific learning disability or health impairment. What I wanted to ask you, Dr. Bylund, before we pivot into these sides, and then we'll also get to the question that someone dropped in soon, is what's the difference between an assessment like yours, which is an independent educational assessment, not as part of the school? Schools do assess students, right? The school psychologist will start the assessment in conjunction with the special educator who does part of it. But what would you say are the main differences between that assessment done by the school and what you do in your private practice or in collaboration with the district when you do an independent educational assessment?
I I can give you a general answer, right? But the fact is that kind of depends on who did the district assessment, because the district assessment is very widely. When I started doing IEEs, trying to think of when that was, in 2010, 2011, at that time, district evaluations kind of across the board weren't great. Like they were very bare bones. And at the time, I would have told you, like, well, our assessments are far more comprehensive than what you're going to get from the district. I still think that's true, but I would say over the last 15 years, districts have upped their game a bit. And to be honest with you, I think sort of the arc of special education has been, again, I'm just hopefully this doesn't offend anybody. I'm just honest, right? But the arc of special education has been pushed by people working outside of schools. Like if you look at even like major special education laws that have been passed over the past since the 1950s, right? So the last 75 years, God, that's crazy to think about. 75 years. That wasn't because the school district got out in front and said, like, hey, we need to do a better job. That was because parents were demanding more for their children. The advocates and attorneys working for parents were demanding more of the school for these children. There was outside assessors, sort of providing, examples and training on how to do a better job for doing these evaluations, right? And that's not a hit on the school district. It's just the way, big, large bureaucracies function, right? And sometimes they need more of a push. I have seen, and I think it's in large part because of the comprehensiveness of outside evaluators over the years, it has pushed school districts to really up their game in terms of their assessments. When I started doing this, nobody was looking at executive functioning. When it comes to reading, nobody was looking at orthographic processing. Most people weren't even looking at phonological awareness or phonemic awareness at that time, right? People just, the assessments were pretty bare bones. And now when you take a look at it, when you look at reading, most people are looking at, for example, phonemic awareness, rapid naming, and a lot of them looking at orthographic processing too, which again was not even seen, in my experience, 10, 15 years ago. And I think too, if you go back 10 or 15 years, that was when the brief first came out. One of these rating scales of executive functioning. I mean, it was brand new. Like the assessments didn't even exist, right? And now routinely you see schools giving the brief. Now you might not see them doing some of the more in-depth testing, right? So they might not be giving a continuous performance test to really measure how well they can focus and sustain their attention. I think that's going to change. If you work for a school district and you didn't know this yet, I'm going to give you a little tip. A lot of times people didn't do the continuous performance test because the test was really expensive. Like you could only load it on one computer and it cost over $2,000, right? So the school district would never do that because they'd have to give each psychologist $2,000 to plug that flash drive into their computer. It's now available online for each individual use, right? So you don't have to have the $2,000 thumb drive for every psychologist in the district, So I think increasingly, these tools are more and more available, and we'll start to see them done more and more. But back to the question, I mean, I think one of the differences is the comprehensiveness, right? We're going to take the time to really go in and take a look at all of these areas. Another area that I think ours differs is just in how we communicate our results. Now, if you pick up a school psych report, I don't think a random person on the street knows what the hell that thing says. Like, I don't. Like, good luck. Like, I challenge somebody to go in front of Target and randomly ask people what fluid reasoning is, or randomly ask people what phonemic awareness is. Nobody knows what the hell those things say, unless you have really specialized training. Now, because a lot of times ours are used for like these independent educational evaluations, unfortunately, ours are sometimes difficult to comprehend too. But I think what we try to do is try to communicate our results in ways that make sense to people, right? So we kind of like, don't spend a whole lot of time describing tests or describing statistics or numbers, but really talk about skills and how they manifest, right? And I think that makes it a little more approachable to families, and then well, and teachers too, right? Like, there was this research I read years ago where they gave these psychoed reports to like both parents and special educators, and both groups came away saying, I don't know what that said, and I don't know what to do with it. So if the special educator doesn't know what that report says, then how are they supposed to use that to develop an IEP? Right, or implement a service, right? So they don't really make any sense. And then the other piece that's probably different is just in the specificity of recommendations. I've been around schools for long enough where I've seen the pendulum swing from provide recommendations to don't provide any recommendations, because that leaves us liable to actually provide what you've suggested, right? To now sort of this space where it's like just very generic, like I think they need extra time and preferential feeding, right? Which isn't really prescriptive enough to be of any use, right? So I think that's the other way ours is a little bit different, is we're going to go through and say, for all these areas of need, what are things that we could do to help compensate or accommodate for those challenges? And then what do we need to do instructionally to try to develop the skills that are lacking? I think those are the ways the reports are kind of different. But again, some districts do a far better job than others. Some psychologists within a district do a far better job than others. So it's hard to say like universally, but that's a general pattern that I see.
Thank you. And I really appreciate your honesty. And, you say, oh, I don't want to offend anyone, or, I hope it doesn't offend anyone. But the truth here is that the reason I wanted to host this webinar is not to offend people, but to say, like, hey, this is the future, right? Or this is what people, if we're trying to help students in schools, whether it's public, private, whatever, one of the biggest things I've seen as a special educator and as an executive function coach is that executive function skills don't always show up on those school assessments. And, Dr. Bylund, I know you and I have worked with students who test, their assessments from the school look like they're doing fine, right? They're cognitively, they're there, but they're really underperforming. They're not turning in assignments, even though it's not showing up on some of these assessments. So it's so important, like you do in your assessments, Dr. Bylund, to go through with a fine-tooth comb and really figure out, like, where is the gap? Like, if their cognitive intelligence is fine and they can read and decode, like, what's going on? And I know you've been able to really uncover, things related to orthographic processing, all these little details that would often be missed in kind of a more generic assessment. So we do want to challenge ourselves as educators in a community here to push the process forward. So I'm really glad to hear that you're saying that the kind of assessment process is improving based on the private work and a combination of things.
Yeah, and I think, a phrase that always kind of comes to mind too is like, because a lot of times, just another generic, I could go down a rabbit hole of some of these things in terms of like all the different factors, right? But just to keep it really like high level, right? Like the school district will say, well, we don't see a processing deficit, right? What we need to remember is like the absence of evidence isn't the same as evidence of absence, right? Because you didn't find it in your testing doesn't mean it doesn't exist. And the fact is that every kid gets what they call a WISC, an IQ test. Everybody gets a CTOP, which is a measure of phonemic awareness and related skills, and then everybody gets a VMI, which is a measure of visual motor integration. And so we're given 3 different test batteries, right, with a total of 16, 17 subtests. And we're presuming to know everything about the way a child's brain functions, right? Like we have 100 billion neurons, right? Like 10 or 100 trillion neural connections. And then we gave these 3 tests with a total of 17 subtests on it and presume we know everything about whether or not this child has a processing disorder. It's kind of ludicrous, right? Like someday we're going to look back at this and think it's like caveman science, and like, but that's just the state of things. Now things are getting better. Like I said, there's more assessments now that we didn't have before. Like even in the last 10 or 15 years, oh my God, our test battery has exploded in terms of like the different measures we have and our understanding of what the implications of those measures are. But even in its current state, right? Like we have to have a little bit of humility here, like to walk into a meeting and say, I gave these 3 tests and I'm that confident that like there's no processing disorder, even when the people around the child are observing significant challenges.
Yeah. And for that reason, I really want to appreciate all of our school-based educators and administrators who show up to these types of webinars in addition to everyone else to kind of think about how do you move the needle forward and consider those possibilities that maybe even if it doesn't show up on an initial assessment, there may be additional assessment areas necessary to explore. We have a question here, Dr. Bylund. What type of clinicians should we look for if we're interested in evaluation for possible ADHD, ASD, LD for a high schooler? It seems like there are a number of options. Example, neuropsychologists, clinical neuropsychologists, psychiatrists, other, often varying price points if insurance doesn't cover.
Mhm. Yeah. So there are like a little bit of nuance to the question, right? Like the purpose of the evaluation, right? So a psychiatrist is a medical doctor, right? They went to medical school and then they did some additional residency in psychiatry, right? So they can do psychological evaluations. What they do most of the time is evaluate and prescribe medication, right? And do medication management. So that's the role of a psychiatrist predominantly, right? Like a psychologist can't prescribe or manage medication because they're not a medical doctor, right? They're doctors in psychology. So if you're looking for medication, it would be a psychiatrist, not a psychologist. If you're looking for more of an evaluation, I'm not saying 100% of the time, but typically that's more the territory, like a comprehensive evaluation like you're describing, is more the territory of a psychologist. Now, the word neuropsychology is a tricky one too, because there's some people who did additional medical residency in neuropsychology, right? And then there's other clinical psychologists who did additional like postdoctoral training in neuropsychological evaluation, but never did like a medical residency. So there's a lot of variation. And so I think people who completed medical residency tend to be very protective over that term. But the fact is anybody who's a clinical psychologist and is knowledgeable in the administration and interpretation of neuropsychological tests and brain behavior relationships can do neuropsychological testing, right? That like there isn't like a special license outside of your clinical license. So people might sort of describe themselves differently. What I would really be interested in is like what is their experience related to what it is I'm asking, right? So if we're just assessing for a neurodevelopmental disability, I think, anybody who's a clinical psychologist who does neuropsych assessment, is more than capable of doing that. If you're looking at sort of the interface between neuropsych assessment and the world of education and special education, Sometimes having somebody like a licensed educational psychologist is helpful because they have more knowledge and experience related to special education regulations, program services, right? So I think really thinking about like what is the reason for the referral, what are the referral questions, what am I hoping to gain from the evaluation, and then looking at the person's experience and seeing if that experience really sort of aligns with what it is that I'm seeking. But it would be hard to say like universally, like, oh, if I'm looking for these disorders, it has to be they have to have this title versus the other title, and even a licensed educational psychologist can make DSM diagnoses with clinical diagnoses that are within the scope of their license, right? So there's certain things that they can't assess for and diagnose, but for things like a learning disability or ADHD or autism, as it relates to education, an LEP can do that too.
Is there a best way to find an assessment professional? I know I've been building a directory of professionals I've worked with or I found to be really helpful, but I'm curious, is there like one comprehensive directory that you recommend, Dr. Bylund, for people who would be looking for an assessment professional?
That's a good question. Uh, if there is, I should probably get myself on one.
Right.
I know they're out there. Like we've been on ones like for an LEP, I think like the California Association of School Psychologists may have an LEP list for licensed educational psychologists. I think different professional bodies or organizations may have lists. So like I'm a diplomat of the American Board of School Neuropsychology. They've got a list of providers there. Like a one that really stands out though. I don't know. I think at this point, Sean, I'm gonna go with yours. Maybe you especially.
Yeah. Well, it just makes me realize I'm going to have to gather those because it is challenging for a parent who's looking for that to, sift through all those different things and try to figure out which one's the most reliable. So I think what I'll do is I'll probably create some content around that in the future and then continue to try to pull people we've worked with or who are reputable into the directory I've created around executive functioning. How about we
Be a
keep
really helpful
going?
resource. Yeah.
Yeah, we'll keep going here and then we'll answer a few questions later on.
Yeah.
Yeah,
Uh,
let's keep
and
going.
yeah, keeping but we have 11:30, is that right, Sean?
That's right. Yeah.
Okay, so we still have a little time here, but certainly have a few more slides here that might not take too long, right? So when we're talking about kids with disability, we're talking about kids with disabilities in schools. There's sort of two laws that sort of kind of govern those services, right? So one of them falls under Section 504 of the Rehabilitation Act, right? And the other one falls under IDA, so the Individual with Disabilities Education Act, right? And there's overlap between the two, but both of them function to provide access to education for kids with disabilities, right? 504 is not just for schools, but at any rate, it does provide some protections for individuals with disabilities, right? And so I think it is helpful to talk about the difference of them between them real quick, because a lot of times like a school might say, we don't think they're eligible for an IEP, but we'll offer them a 504 plan, right? And so what is that, and what's the distinguishing features between the two, right? So a 504 plan provides access, right? Certain accommodations, right? For individuals to be able to access their education as adequately as their non-disabled peers, right? So for example, when we're constructing a building, we have to make sure it's constructed in such a way that people of all physical abilities can access the building, right? So I think sort of a framework for thinking about that. And some kids, because of their disabilities, they may struggle to access education in other ways, right? So there's a lot of kids that have ADHD, as an example, who have 504 accommodations but don't require an IEP. So what a 504 does is, again, provide certain accommodations within the regular environment, regular education environment, that allows them to access their education as adequately as their non-disabled peers. Right, so adaptations in the regular education environment. So these are things that are provided in the regular classroom by the regular education teacher, right? So a lot of times it's things like preferential seating. So they're seated strategically throughout the classroom. Maybe they have certain visual tools or visual aids to support their executive functioning skills, right? Checklists or so forth to kind of help them stay on top of their work and complete their tasks. It doesn't require any additional instruction, right? Or beyond sort of teaching them how to use the tool, perhaps, right? Those are the teacher may sort of check in with them to make sure that they have working memory difficulties, check in with them to make sure that they understood the instructions, they demonstrate their understanding, the teacher can then move on, right? So those are things that we might just sort of adapt in the environment. So things that the adult does in the classroom are things we change in the environment around the child that allow them to access their education. When you're talking about an IEP, right, under the Individuals with Disabilities Education Act, we're saying that the child not only requires accommodations, so 504, like 504 plus, right? So they require the accommodations and they require specially designed instruction to not just access the curriculum, but progress in the regular education curriculum, right? So a lot of times, so in California, I think pretty universally, they use the term specialized academic instruction. But what the federal regulations say, the term that they use, the phrase they use is specially designed instruction. And here, I just think it's really important if we're making a distinction about whether or not a 504 is sufficient or they require an IEP, we all have to have a working definition of what specially designed instruction is. And if you're a special educator, I think it's really important that you know what you know what the definition of it is, right? And if you're a parent, frankly, and you're asking for an IEP, it's important that you understand what the definition of it is. Because I think most IEP meetings I would go to, if I were to put anybody on the spot and say, define specially designed instruction, I think most of them wouldn't be able to do it, including the school team, which is sad because then we're making a decision of do they need this or not. So the federal definition of specially designed instruction is adaptations in the content, methodology, and or delivery of instruction, right? So again, 504 is accommodations. We're changing the environment around the child so that they can access their education. Specially designed instruction, again, content, methodology, or delivery of instruction. So if we're teaching them something different than we're teaching everybody else, right? It's not part of the regular curriculum. The content's different. That's specially designed instruction. If they need that, if we need to teach them something different than the general curriculum, due to their disability to help them access and progress in the regular curriculum, that's special education. Methodology, right? So not just what we're teaching them in content, but maybe how we're teaching them. Maybe the content's the same, but we're changing our methodology. We're teaching them in a different way because of their disability, we need to teach them in a different way so that, again, they can access and progress in the regular curriculum, right? And or delivery, right? So I think of delivery as like by who, when, and where we're providing the instruction. Right. So again, this definition, content, methodology, and or delivery, are we changing what they're being taught? Are we changing how they're being taught? Are we changing by who, when, and where they're being taught? Right. And if because of their disability, we need to change one or more of those things, that is specially designed instruction. Right. And so I think sometimes, the school just thinks, oh, here's our special education programs. Which one of these boxes are we going to try to fit this person into without really thinking about what it is that they require. Right. And so again, I think it's really helpful to have a working definition. What exactly is an IEP? That's what it is. Right.
That's huge. Sorry, I just want to put a pin in that, Dr. Bylund. People watching this definitely revisit that. It's so important to know that definition. And it does make me think about how, because of the way special education law is written and law in general, everything is open to interpretation, right? To some degree. And that's the important part for parents, educators, advocates to know that, hey, everything is that do you agree with that? I'm curious. And how do you see the fact that everything is written in a way that can be interpreted? How does that impact how you kind of deliver your recommendations?
Yeah, there's a lot of gray area in special education law, which is very unfortunate because at the end of the day, it makes it extremely costly for parents, extremely costly for school districts. And at the end of the day, the only person that, well, not the only person who's impacted, the person who's impacted the most is the kid, right? So it would be very helpful, I think, for kids at the end of the day and much less costly for everybody if there was more clarity around this, right? So you think about what special education, I gave the definition of specially designed instruction, right? But the two pillars of special education are, least restrictive environment and FAPE, a free appropriate public education, right? And everybody has the same definition of free. Most people have the same definition of public. I think we all have a relatively similar working definition of education, but it's the appropriate part that everybody argues over, what's appropriate, right? And the law is, there is a lot of interpretation. The Office of Special Education Programs and the Office of Special Education and Rehabilitation Services, does try to provide some clarity to these things, right? So they'll put out letters that sort of people can submit letters to them, and they will try to answer them in terms of how to interpret the regulations. And then we have a lot of case law, right? That there's been rulings by judges to sort of help provide clarity around what some of these terms mean. But there is a lot of room for interpretation. Um, as far as like the last slide, like I do think, you know, I do like that definition of specially designed instruction, right? In, you know, there's still some wiggle room there, I suppose there, like can you provide, can you adapt your methodology within the regular education environment, right? Can you, I suppose there's ways to sort of, um, somebody might try to like argue their way through that, but I do think it's pretty helpful, right? To say like, if we're changing what is being taught, how it's being taught, and by who, when, and where it's being taught, I think that is a helpful way to think at least about whether or not somebody qualifies for special education, right? So I wish I'm going to challenge myself here to think of, there's 5 steps that we came up with in our office, right? So, like one, is the child, does the child, have a disability, uh, because that would qualify under either 504 or IEP, right? How does that disability, does that disability impact them educationally, and how, right? Um, what would we like to see them doing differently, in order to be able to better access and progress in the regular curriculum, right? So they have a disability. How's it impacting them? What do we need to see them doing differently in order to be able to access their education? And then question 4 is like, okay, what can we do? What's the least invasive way of like helping them to be able to do that thing that they need to do differently, right? And then if you get to that point and then you list out what are those things they need, right? Then just clear your mind and go down your list and say, are any one of those a change in the content, methodology, or delivery of instruction? Right. And in my mind, if you went into it with a clear mind, right? I'm not saying it's a 504, I'm not saying it's an IEP. I'm going to be objective as possible and say, what do we need to provide them so that they can do this thing that will allow them to access their education? And then if we were to just hold it up, like, which ones are accommodations? Which ones are changes in content? Which ones are changes in methodology? Which ones are changes in who, what, and where, right? And if we have any of the, you know, what, how, who, why, and where, like if we meet it, then that's specially designed instruction. So I do think it's helpful to kind of walk through that process. Anyhow, but yeah, the law is yeah, there's far too much interpretation, and in California, it's probably the most challenging state to sort of navigate through all of this, as far as both for districts and for families.
Thanks for shedding some light on that, Dr. Bylund. Yeah, it's very challenging, but I always appreciate the clarity you bring to the question around eligibility through your detailed assessment process. And I love that you have that questioning process to evaluate if they are a good fit. So thanks for kind of moving the needle forward on that one.
Yeah, for sure. So what is an IEE? It's an independent educational evaluation. Parents' procedural safeguards, parent rights. One of them is the right to request one, not the right to get one, right? But the right to request one. And what it is a second opinion assessment. It's not, it doesn't dictate what happens moving forward. It's a second opinion assessment to offer additional information for the entire IEP team to consider in making decisions around special education eligibility or services. So, parents think like, oh, we're going to get this outside evaluation and whatever they say goes. That's not what the law says, right? It's providing additional information for the team to consider. Now, I think if you do a really good IEE and you're very detailed in understanding, the nature and manifestation of a child's neurodevelopmental disability, if that's the case, I think they can be a very powerful tool, right? And especially if the person doing the evaluation is effective in communicating the results. There's a lot of wonderful clinical psychologists out there who do great IEs. I do think one of the advantages of having somebody who also has experience in schools and as an LEP is because they also understand the special education side of things too, right? Understanding things like what specially designed instruction is, right? I think can be helpful, when looking for an IE provider. Not to say that they have to be an LEP, and that there's a lot of clinical psychs who've done a lot of IEs for a long time and understand this stuff really well, right? But when you're looking for an IE, part of it is like the clinical expertise of the assessor, and part of it is their ability to communicate that in language that kind of moves the needle forward for the kid in school. So an IE provider is somebody who's independent of the school district. They can't be a W-2 employee of the school district. One thing I would keep an eye out for, and I might be jumping ahead here in my slides, is there's a lot of school psychologists / LEPs, licensed educational psychologists, who have left their district job and make most of their income as a 1099 contractor for school districts. And they also do IEs for those districts. I think that's a good question to ask the potential assessor. Because the law says they have to be independent, they can't work for the school district. So immediately you have the question, well, if you're 1099 employed by the district, are you employed by the district? Just immediately. But I would say that somebody who's a 1099 employee of the school district or even other school districts nearby is even more ethically compromised. Because if you were a W-2 employee of a school district, you're protected by your contract and you're protected by your union and they can't get rid of you. Now, the law clearly says you can't be a W-2 employee of the district, but let's just say that that was the case, right? Say you're a 1099 employee, they could cut off your assessments tomorrow. So that creates a real ethical dilemma if you're an LEP contracting with school districts and doing IEs, right? Because are you willing to make what's the strong recommendations for that child if you know you could lose your $30,000 contract with the district tomorrow? And I would say too, even if they're not employed by that district, are they employed by local districts as a 1099 employee? Because if I work for District A and not District B, but they're next door to each other, those directors know each other and communicate. And so if I let go my contractor because they made some strong recommendations, they're going to let the other district person know, right? Which again creates an ethical dilemma for that assessor, knowing that not only their contract this year could be jeopardized, but their contracts next year with the district next door could be compromised. So I think it's an important thing to consider when you're looking for an independent evaluator, that they're not also a 1099 contractor as a school psychologist. So again, and the parent can request it. The district, again, the parent can request it anytime they disagree with a district assessment, right? So what are some reasons that a parent might? One, the assessment's unclear. That would be 100% of assessments, in my opinion. But so we don't want to disagree with every single assessment. Try to get some clarity and understanding the results, right? But maybe you believe it's inaccurate, right? Or you don't think it's thorough enough. Maybe the assessment results don't match up with your child's lived experience, right? They're saying they don't have any executive function challenges, and yet they're really struggling with all these things that we talked about today, right? It just doesn't make sense. Maybe there's important areas that weren't adequately addressed, like maybe they didn't really look at executive functioning, and that's an area of need, right? Then that's another reason a parent might disagree with the evaluation. Now, it might not just be with the disagreement with the evaluation itself. It could be with what some of the results of the evaluation led to, right? So if you think about like an IEP, from eligibility onto goals and services, it's all built on the assessment, right? Because the assessment determines eligibility. It determines what the areas of need are. The areas of need drive the goals based on how they did on the assessment. And the goals then drive the services, right? Like what's the treatment plan, for addressing these areas of need. So if there's any disagreement with the appropriateness of goals, appropriateness of services, a child's progress on goals in response to those services, those may, I'm not saying they are, I'm not telling you everyone to run out and grab an IE. I'll get burned at the stake. But those are potential reasons why somebody might want to get a second opinion, right? To make sure that we've identified the needs accurately, whether it's eligibility all the way down to services. How to request one, submit a request in writing, right? Make sure you put it in writing, whether it's your initial request for an IEP or request for an IE, put it in writing, right? Verbal requests are not going to hold up. You want to have documentation of it. Oftentimes people might wonder, well, who do I submit it to? The people oftentimes that you're interacting with are the people at the school site, right? So if they already have an IEP, maybe it's the case manager, the school psychologist. If you really want to ruin their day, tell me you disagreed with their evaluation, you want an IE. But these are people at the school site, right? But the fact is, the people at the school site, the case manager, the school psychologist, the principal, and the principal might not know a whole heck of a lot about special education, right? The people who make the decisions around an IE is granted or not are the district people, right? Ultimately, the district director of special education. So you need to get your request in front of the district director. Now, if there's a program specialist or program manager that you've interacted with a lot at the district level who works directly under the director, that might be another good person you could submit your request to because they have a direct line to that director. But at the end of the day, your request has to get in front of that director. And if you gave it to the school site people, that might, depending on what district you go to and how familiar they are with IEs, because some districts aren't familiar with them. Some of them are very familiar with them, right? So the chain of command, at the end of the day, you got to get that request up to the director. So I would include that director on your request. You don't need to explain why you disagree. There's nothing in the regulations that say you have to. The district will ask you, why do you disagree with the assessment? Because they're going to try to resolve the issue. That's completely understandable, right? If there's something they can help resolve, of course they're going to offer to do that. But you don't have to explain why. You just need to say that you disagree and request an IE. If you want to explain why, right? But you don't have to. And part of the reason why is because if we're a parent and we're not a neuropsychologist, we're not a school psychologist, we're not a special educator, I've gotten this stack of papers that don't make any sense whatsoever. And the people who have explained it to me have not explained it to me in such a way that I can understand it. And it doesn't sit right because the conclusion doesn't seem to fit my real world experience. You're not responsible for knowing what should have been done differently, right? You're not responsible for saying, oh, they should have given this test instead of this test. No, right? You just know that you disagree, right? And that's all the law requires you to say, right? Now, again, I'm not saying don't explain it to them. I'm not saying don't try to resolve it with the district and be collaborative. I'm not saying any of that. But know that you don't have to fully know how to articulate the reasons why, right? You just have to disagree. And the district either has to fund the evaluation or they have to defend it in a legal hearing. They have to do what is called file for due process. I don't know, maybe at some point here, districts start pushing back a little bit more. The pendulum swing back and forth a lot. In my experience, the school district would have to have an airtight case that their assessment not only met all the legal requirements, but like they didn't miss anything. And then even then, they'd have to explain that to a hearing officer who's not a neuropsychologist, who's not a special educator, and do that effectively enough to not have any window of doubt. And that's a tough thing, I think, for districts to be able to do, and a costly thing for districts to do potentially when they don't know what the outcome is going to be. And I think for that reason, for the most time, they're gonna fund it, right? Now, personally, I got into working. I've been a school psychologist, I've been a program specialist, I've been a district director, I've done all those jobs. The longer I was doing those things, the more my job veered me away from getting into why I got into this in the first place. And that was just flat out to help kids, right? So I feel like in my position now, I'm able to do what I've always wanted to do, right? Which is to be able to help kids and help families. And I get a lot of, feel a lot of reward in doing that, right? And I forgot where I was going to go with that. No, with that said, I also think that people like myself need to be doing ethical assessments, right? Like we're not going to go in and say, oh, this is a horrible disabling condition that cannot be remediated in any other way other than special education. So hopefully everybody out there is doing similar, right? And hopefully funding the IE avoids later legal costs, right? That we can provide information that everybody at the table can come together and agree upon, right? Like I had an IEP the other day where, the district assessment said no difficulties with reading. I did a very this kid had every difficulty with reading, right? And the general education teacher said the same thing, right? like everybody came together. The general education teacher was like, no, I agree. Like definite difficulties with reading, like needs help with reading, right? So hopefully it's a time when everybody can come together and find some agreement on what is needed, right? And we can avoid all the additional legal costs. And in that world, I think it's easier for the district to move forward to say, okay, let's just gather more information. Let's come back together a team and let's reconsider our decisions. I think we've talked about this a lot. God, I didn't think we were gonna get anywhere near 90 minutes, and here we are on the edge of it. I think I've covered a lot of this stuff, like things to kind of think about. You don't have to choose from the district list. They'll offer you a list. You don't have to choose from the district list. We're on some, we're not on others. We've been on some and are no longer on others. But you don't have to choose someone from the list, right? They should be independent from this district we talked about. I think it's helpful to have both clinical experience and experience with special education regulations. And, my little plug, I think we do a good job. So maybe I'll sort of pause there. Were there any other questions that came up, John?
Yeah. So first off, I know we're 5 minutes before the end. Yeah, you're right. I was like, oh, this might just be 20 minutes. But look at us, almost an hour and a half in. I think it's partially because there's so many good questions coming in
Yeah,
from the
for sure.
people who joined today. So thank you so much for joining and sharing your questions. I don't think we'll be able to get to everything, unfortunately, but you see Dr. Bylund's information right there. We will also send it out after with the recording, so you can follow up with him with any specific questions you might have, and then we'll do our best to get to whatever we can in the remainder of the time. Um, so first off, before we hit right the edge of 11:30 and have to wrap up, I want to give a huge thank you to you, Dr. Byland. Thank you for educating us, sharing your expertise with us. I feel like we just scratched the surface, but also got into so many valuable tips that I'm taking away, just, deepening my understanding of this process and what to look out for. And so thank you so much, Dr. Byland, for sharing your expertise with us.
No, thank you. I appreciate yeah, Sean, I appreciate you inviting me to join in, and I really appreciate all of the people who came to join live and asked the questions. They're really excellent questions, and as a presenter, it's really nice to be able to have that interaction with people. So I appreciate that, and also appreciate anybody who's watching this after the live recording too.
Yeah, and let's give a little love to Dr. Bylund in the chat box. You can drop in a thank you or clap or whatever emoji you like. So let's appreciate him there because he did a fantastic job for us. And this recording will be available. We're going to be posting it on the YouTube channel for EF Specialists so people can watch it. Before we jump into a few final questions, I do want to share a couple things for people who want to go deeper with any of these topics. So make sure to take a screenshot or look at that information for Dr. Bylund. Before I stop that share. But what I'll do now with you is I want to show a couple things to you that might help you take this a step further if you're really enjoying this content. So first off, you can just Google the Bylund Clinic and find out more about Dr. Bylund, learn more how to contact them, check out resources. They've got an awesome podcast. I'm grateful I had the opportunity to be a guest on it recently, but there's so many other, you know, experts that Dr. Bylund has interviewed and chatted with that can deepen your understanding of this topic. The other thing, as I shared earlier, is we do have a lot of events at EF Specialist, so you always can join our newsletter. I send out an events email every Monday. And then if you want to go deeper with this topic of special education and assessment, go to our articles page. You can scroll down to special education. And as I shared, we have all of our articles on special education, our top articles, tips for people wanting to work on this, best resources, and then all the stuff on assessment and special education there. A couple articles I do think will be very helpful for people. We have one on what is an independent educational assessment. There were some questions about who completes it, who pays for it, why would I want this completed? So check that out. Um, I shared with people, we were talking about autism and activities of daily living. There is some stuff there that can be helpful. And then I think some people are wondering, like, how do I help my child or how do I improve their confidence if they're struggling with executive function challenges or we've identified that they have a need here. So, as a parent or educator or concerned individual, this is a detailed guide on how you can advocate for executive function coaching. As many of us know, that is one of the missing links to helping kids who are assessed for executive function challenges, but maybe the school doesn't offer something specific around executive functioning. So this is like a very detailed guide with a also a resource, a workbook that you can use to learn how to advocate for executive function supports as part of the IEP. So I could just keep going on and sharing resources. So I'm going to stop there, and I'm going to kick it back over to you, Dr. Bylund. Unfortunately, I just don't think we're going to have a chance to get to all these great
Yeah.
questions. So what I'm going to do is I'm going to save them. I'm going to send them to you, Dr. Bylund, and maybe they can be kind of a resource for you to think about upcoming content for your
Yeah,
podcast or
that's
blog
great.
post. And then you can also follow up with me, anyone who had some of these questions, just because I know we're hitting the 90-minute mark. Do you have any final thoughts or best ways to get in touch with you, Dr. Bylund, if people want to follow up with you and learn more from your expertise?
Yeah, I mean, hopefully, if people took a screenshot or jotted down our contact information, you can reach out to us through our website, or just email us directly at info@drjamesbylund.com. Annie, our office manager, is wonderful, and will connect the two of us if you have follow-up questions about any of the content today.
Fantastic. Well, I just dropped your link into the chat box. We'll send that out along with the recording of this. And huge shout out to everyone who took time out of their Monday. Mondays are busy to come here and learn about how to help kids with executive functioning challenges and deepen your ability to support. So give yourself a little pat on the back. We appreciate you. We're especially appreciating Dr. Bylund, and we will see you all soon, hopefully at another upcoming event.
Thank you, everybody.
Bye, everyone.